Welcome to all of you, and it's very good to keep welcoming new people as well, Janet, as you were saying. So a big welcome to Vicky Thompson and Joanna Powell so Joanna is from East Bedford PCN, and Vicky is from Medics in Luton. So welcome to both of you, and you'll be very glad to hear that I'm not actually going to put you on the spot and ask you to introduce yourselves, because I think we need to get going with the webinar, and we have a special guest today in Karen Story. So I wanted to give her a bit of time to say something before we get started. Just to confirm, this is the 4th webinar in our series of 12 webinars, and so we've already covered population health management, and we have gone through setting up for success. We've looked at project management and setting up your projects, and we've looked at influencing, how you influence, how you impact change in your primary care networks. And today we're going to be looking at how to build and lead great teams. And we've got Nav Chana is going to share some theories and some very practical insights and models into how we can do some of that. We have, as we've talked about before, we've taken on board the feedback that you've given us about wanting to have as much time to talk in your breakout groups. So we are going to have lots of different inputs and lots of you having an opportunity to go into breakout groups. Because I'm putting you into a breakout group straight away from the get-go, I am going to try and put you into regular breakout groups so you can get to know each other. But for the first one, it's going to be a random selection. So I'm just going to warn facilitators that you might have that moment when you think that you're in one room and you suddenly appear in a different one because I needed to move you. So that might happen in the first one. But before we get into that, we're looking at teams, and the first thing I asked you to do last week was to think about a positive and a negative experience of working in a team. And the first breakout group will be for you to reflect on that together, to start to think about, well, what does that look like then in terms of what makes a great team. Before we get into that, I wanted to ask Karen, our benefactor, first of all, to say hello, because Karen, some people won't have actually met you because you're not here on every session, so it'd be really great if you can just do a quick introduction. But also Karen said that she would share with us and some of her experience of being in a team, and I'm not sure yet, I'm on tenterhooks as to know whether it's a good or a bad experience, Karen, that you're intending to share with us. But can I ask you to introduce yourself?
Thanks, Claire. So I'm Karen Story. I'm primary care nursing lead at NHS England, NHS Improvement, and I have a national role to deliver the General Practice Nursing 10-point plan, which I'm sure all of you will be familiar with. The plan's been 5 year. It's a 5-year plan. We're in the final year, and it's aimed at around recruitment, retention and return of general practice nurses. So as part of that programme, we have commissioned NAPC and Shiny Minds to deliver the care programme, and working with yourselves and 6 other areas in the country, we hope to embed the programme so that we can empower general practice nurses to lead in primary care networks and to do what they do best, which is their knowledge around population health management, which you all have, but don't often recognise that you have that knowledge and the ability to lead as well, which is in us all and just takes a little bit of releasing. And then what we found by supporting and investing in general practice nurses' leadership potential, that people are off before we know it. So lots of high expectation for this group. So you asked me, Claire, to have a think about my own experiences of teams. So I have to say I've probably had a fair number of jobs in my career. Looking back, that's been the price to pay for being married to somebody in the military. So we've moved around a fair bit, and from my own experience, if the team isn't working particularly well, I usually vote with my feet, in all honesty. You know, I will give it my best. I consider myself a fairly good team player, but sometimes when things are not, if they're not going as you would hope, then it's, yeah, there's been opportunities that I've moved on to the next thing. So I'm not advocating that everybody does that at all, but I think what it's helped me recognize is that my own values have to be met in a team. And I, like all of you, probably have quite strong values and things that we value most. And actually, through some work that I did with Beck, through using the app and through some coaching that I did with Beck, top of my agenda is trust. So I have to feel that I can trust the team, and I have to feel that the team can trust me. So in those teams that I've worked really well, I would put trust as my top value, and without actually pinpointing any particular organisation that I worked in, I've probably just looked at collectively throughout all of the organisations that I've worked in, what did I really value most? So for me, it was around appreciation of each professional's contribution for mine and others, having respect. If there was respect in the team, it worked well, looking out for each other. A measure of a good team, both myself and actually a colleague, Dr. Martin Wilkinson, we use this as a measure of a good team, was who makes the coffee in your team. That's always a good measure. If you all make the coffee, then there's fair distribution within the team. Being able to contribute to the team, being recognised for my contribution, knowing that I could lead and make a difference. Having some downtime as well, social interaction, informal networking in the team, and gatherings, Christmas parties, etc. And I've also gone on just to say a few other things that perhaps didn't work so well in a team. So I don't know, I think I'm not particularly good at being micromanaged. If people are always criticising things, or if there's as I said, putting red pen through your work continually, that doesn't always work. And perhaps if your ideas are not well supported, or if you haven't got your boss or your team member that considers all of your ideas, weighs up all of the options, so you're able to have a debate around things. Yeah, that's my personal reflection. So hopefully there's enough there for you to have a little think about.
Thank you very much, Karen. That's really helpful. So I'm going to now, and I've been able to, thank you for giving me some time to get the breakout rooms to work as well, Karen. So I'm going to put you into a breakout room now. For those of you who have not been used to this, you're going to be with people who will be able to talk you through it, and the facilitators will give you a chance now just to do a bit of what Karen's just started us off with, and reflect on what makes great teams from your own experience, what you think has worked and what you think actually is really something to avoid. So I will see you shortly. Somehow you came back much quicker than everybody else. I don't know why.
Maybe it's because you brought us back.
Maybe I brought you back, but I pressed the bring all of you back, but you came back quickest. So there you are. Sterling effort, Janet. Fast off the starting blocks.
Oh yeah.
Never
First
lost.
isn't always best.
No, point taken. Point taken.
Oh dear. So is everyone back? Have we all got back? Excellent. So I popped into all of your breakout rooms and it sounded like you were having really good conversations. So I'm sorry to have stopped them, but as I said, you will be going back into the breakout rooms very shortly. So now we just wanted to take a few minutes to have a look at some models, some theories around teams, and really some practical insights from the lovely Nav. So Nav, I think you should be able to control the screen for your slides. Let me know if that's not true. Are you able to do it?
You're on mute at the moment, Nav.
Oh, there we go. Nav, we can't hear you. Nav?
Okay, can you hear me now?
Yay.
And you can see the slides as well, yes?
Yes, yes.
Thank you. So it's really hard to get feedback when you're doing a passive learning session like this. So any form of noise or grunt or you know is welcome. Okay, so I'm literally just going to be a few minutes on this, colleagues, because I think a lot of the richness of the discussion is you know a lot of the theory comes from the richness of discussion that you've already had. So I just wanted to share with you. So a lot of the evidence about effective team-based working comes from a bloke called Michael West. Have you heard of this guy's name? If you can sort of nod or whatever. He's basically you know, a professor of occupational psychology and has done many other things in time. But a lot of the core research about what makes effective healthcare team working has really come from Michael. And so what I'm going to do is I've shamelessly pinched some of his thinking here. So forgive me on that, but I hope it kind of links back to some of the conversations that you've been having. So this slide is just saying that based over 20 odd years of research, and the only caveat I would make is that this is based a lot in hospital-oriented research, so teams working in hospital environments rather than in primary and community care. But I wonder if there are some parallels that we can pick on. But so I guess what the evidence suggests is that really effective team-based working has the opportunity to reduce you know, secondary care costs, improve innovation. You know, people working in teams generally have a more fulfilled and enjoyable experience at work. And interdisciplinary teams, and I think, you know, I was hearing examples of that from the colleagues when we were talking. When that happens, it's understanding and appreciating each and other's roles and skills in the context of what you're trying to do. That, as you could imagine, does improve the ability to, you know, provide higher quality care and improve innovation. So I guess I would say all of that makes sense. Other research has shown more recently that you can actually demonstrate better results in terms of, you know, hospital-oriented mortality statistics, error rates, sickness absence, and you know, people feeling more engaged. So there is definitely some value, you know, attributed to highly effective team-based working, and I'm guessing that no one on this group would disagree with that. And if you do disagree, could you just flick something at me and let me know? But I'm making the assumption that we all feel comfortable with the fact that team-based working, which is effective, is an important construct in the context of delivering care to people and patients. Okay, so that's the kind of key message around this bit. So the next bit is what Michael West's research has shown, and it's been replicated and indeed duplicated in many different ways across many different environments now, is that essentially to define whether you're in a really effective team, so for effective team-based working, there are many conditions that need to apply, but essentially these three conditions would seem to be paramount. Okay. And I was hearing elements of that in the conversation that we've just had. So the first thing is understanding that your team has a clear objective or a clear purpose or a clear set of objectives around a clear purpose. So, these are not meant to be absolute, and sometimes the words can be a bit distracting, and we can debate what's an objective and what's purpose. But I think you get the point here, isn't it? That you have to have a clear set of ideals, goals, objectives that people are working towards to be a really effective team. And in terms of numbers, well, I think it's very hard for teams to behave properly, and we can talk about what that means in a minute, if your numbers are more than about 12 or 15. Okay, so it's quite hard to describe a team working effectively if we're talking about 100 people. So we're talking about 10 or 12 people working closely around a set of common objectives or common goals, and you can break that 10 or 12 people into smaller groups or smaller teams. There might be 3 or 4 or whatever, but the same conditions apply. Does that make sense? So having a clear purpose, clear set of objectives, and keeping the number of people to a manageable amount where you can interact freely is an important condition of highly effective team working. So that was the first thing. The second thing is, and again, we were picking this up in the conversation, do we understand what individuals' skills, abilities are in the context of that shared objective? So do we have a better understanding of the interconnection between people and how they can work together to deliver great care? Okay, so there's a lot in this. It's part of having the environment, understanding what people can do, what their abilities are, what their potential abilities are, how we can coax the best out of everyone, how we can make sure people are targeted to be doing the right things based on their skills, experience, and training. So the mutual interdependencies between people are really important in terms of the second key construct of effective team-based working. Okay. And then the final thing, and I guess this is for me the greatest challenge, is that teams often kind of come together in a moment in time. How do we create an ethos and a culture of effective team-based working over a period of time? So where the team itself spends time together, considering how it's doing, where it needs to develop as a team. And actually kind of spend time thinking about that, reflecting on that, and then doing things together to improve effectiveness. And many of you will have examples, won't you, of great social experiences you've had within teams, or spending time together, understanding how you're working and how you could improve. So that third bit about how the team itself grows and develops is a really important facet of effective team-based working. And I guess, judging by my own experience, that third objective is often the hardest to deliver. All right, so we're not just here talking about meeting to have a case discussion about a complex patient. I think we can quickly get together around that, can't we? But it's how does that, over a period of time, over months and maybe years, how do you keep that sort of team working effectively over a longitudinal period of time? So those are the 3 key aspects of highly effective teams. Okay, so I want you to remember those 1, 2, and 3. So what I'm going to show you now are a couple of slides which illustrate what happens when you have effective team-based working with when you don't have effective team-based working. You with me so far? Thank you. So the next slide, in this chart, so you remember those three characteristics of effective team-based working. So when they all apply, we call that a real team. Okay, so that's defined as a real team. When only 1 or 2 or 3 apply of those 3, so when only 1 or 2 apply, they're called pseudo teams. Okay, so a pseudo team is defined by maybe only one of those characteristics happening. In this case, it's possibly only 2, and it could be the 2 could be any 2 of the 3. And over here on the left-hand side of the graph is not working in a team at all. All right, so actually, You don't give a monkey's about working with anybody else. You just want to get on and do your own thing and you know, stuff the rest. Okay, so that's kind of a bit of a caricature. So when we look at the kind of, you know, the kind of concept of job satisfaction and enjoyment at work, clearly, if you're in a real team, you know, you get a lot of satisfaction. Okay, if you're not working in a team at all, you don't give a monkey's. It's not bad. It's actually, you know, it's probably better than any other form of team-based behavior, which what we're calling here are pseudo teams, teams that pretend they're teams but they're not. All right, they pretend they're teams but they're actually not, because they've not invested in all the 3 characteristics of highly effective team-based working. Does that make sense? So if I just show you another chart taken from Michael's work. This is about, you know, errors in healthcare, stress and injuries actually caused to patients. So quite an important construct around patient safety. I'm sure we'd all agree. So here again, a real team has the best outcomes in terms of reducing errors, you know, improving stress and reducing injuries. Not working in a team at all, actually just getting on and doing it yourself, forget about talking to anybody else, isn't bad. It's not far off working in a real team. But any other construction of teams in that pseudo team environment, i.e. not all those 3 things apply, only 1 or 2 apply, is actually far more detrimental to health outcomes and patient care than actually not working in a team at all. Okay? Are you with me so far? So I guess the key message from these 2 slides, and there's a whole raft of others that we could show, is that working in a real team, a highly effective real team, is very important. It improves healthcare outcomes. Not working in a team at all and actually just doing it yourself isn't bad, but it's not as good as working in a real team. But any other construction of team-based working where people think they're in a team but they're not, because those 3 conditions aren't applying, is actually worse for healthcare outcomes and personal satisfaction and job satisfaction than actually working on your own or working in a real team. Isn't that weird? Yes, it is weird. And I would say to you, and I'm going to be quite challenging here, the majority of healthcare teams are pseudo teams. They're not proper teams, okay? Because not all those 3 dimensions apply. All right. So I would challenge to you, my challenge to you as emergent leaders in this field is to really think carefully about how you make those 3 things apply in the way that you design teams. Okay, so we're nearly done. You'll have seen you'll have seen this slide and the work that we did on the population health management side. And I just want to draw this conversation of team-based care back to what is the point of it all. You know, what is the point of having highly effective teams? So what's the purpose? What's the goal? And we showed you, didn't we, a sort of strategic view of how you think about populations. You know, that's that 3x3 framework. That's a sort of high level overview of a population. And you kind of think about, well, how do I identify groups of people within those cells? And Jag has also, I think, shared with you a much more kind of granular a way of looking at groups of people who share common characteristics. Yes, so just again to link back that when we're thinking about teams, maybe we're thinking about teams working together in the context of patients with COPD, or in the context of patients with frailty, or in the context of patients who are high emergency service users. But kind of that gives you the purpose around which your team is constructed. That makes sense? Right, so then the last slide is just trying to put some of this stuff together. So this is just my personal reflection, by the way, so don't think this is in any way a direction or a diktat, but maybe a suggestion. So for me, the key thing about building a team, particularly if you've not established a new one, and remember, if we're going to work on population health outcomes, we might need to be thinking about how do we design a team that addresses the needs of particular groups of patients. So this might be a new group of people coming together to kind of target that need. Yes. So the first thing is really think about the care functions, the group in question, and we've spent a lot of time, haven't we, thinking about that. Yeah. So care functions, I mean, sorts of things that pop into my mind. Let's just take a group of people, say adults with learning disabilities. The care functions might be, you might have someone who's good at making a diagnosis and working out what might be wrong with someone if they become unwell. But you might also have care functions around medicines management, or care functions around care navigation, or social prescribing, or something psychological that those people or those groups of people need. So, and I'm not telling you what those care functions are. That's for a group of individuals to come together and define. But essentially, once you've identified what the care functions are, you might then start saying, well, who's got the skills in our group of colleagues to kind of address some of those care functions, and that's where this concept of interdependency comes in. So we might have some great nurses who can deal with certain aspects, psychological aspects. Say, we might have a doctor who's really good at kind of medicines management, or we might have a pharmacist who can really help with some of the diagnostic challenges that we face. So we start to tease out who's got the skills that enables us to address the care functions. And if we haven't got the skills, we might start to think about what training is needed to get people into that right space. So that's a really important part of that second characteristic of effective team-based working. And then the third and final thing then is point 5, how do we make that team effective? So how do those groups of individuals come together, spend time together, think about how they're working as a team, how they grow and develop together, whether that's socially, whether it's as part of regular meetings, spending a bit of time outside of the discussions about individual patients, to think about how they're doing. And Karen's conversation about somebody making a cup of coffee or a cup of tea for somebody else made me think about, in our practice about 6 months ago, we have one fridge that everybody shares for their milk. It's our milk fridge. And it struck me that everyone had their own bottles of milk with their names on them, so that they could just take their milk rather than have a group milk. Now, it's not because people have allergies or anything. It was just that it felt like that was a marker of not a proper team, right? Because people weren't really sharing a resource together. So we've addressed that, and everyone's now quite happy. But I guess it's just little things that make the team work in a way that's effective through spending time and socializing and growing together. So those are the 5 points I suggested that we might focus on for further discussion. And Claire, my time is up, so I will end there and open up to any further questions later on.
Thank you very much, Nav. Are you able to switch off your slides as well, so that we get the full group back again?
Sorry.
It's all right. Thank you for as always a very helpful, inspiring session on team building. I hope that was helpful to everybody. We've now got the timing is slightly out, but I think it's really important that we give you the time in your breakout groups to really get into discussing this now. So you started some conversations about your experiences of working in teams. Now's your chance to start to think about how you might put your team together, taking account of what Nav has talked about and those 5 questions you might ask yourself. Who is it that I need in my team? How am I going to put this team together? And what are some of the things that I need to do to make all of this work? So I'm going to get you set up and into your breakout groups and give you 30 minutes just to chat. I'm going to keep coming in just to check how you're getting on, and we'll close it early if we can, but I want you to have the time. So I will see you in a moment. Hi, welcome back. I think, is that all of you back in the room? I was just saying, I'm never quite sure whether you have actually finished your discussions. So hopefully you get enough notice that I'm about to flick you back into the main room. I try and make sure that you are. And I hope you were able to have some good discussions. As I said, I've given you the time to really spend in your breakout group just now, which means that I'm going to have to shorten some of the sessions that we have from here, but I hope that's okay. I think we can still get quite a lot out of them. And the first session that we're going into now, and I hope that you've brought some questions out of your breakout groups for this bit, is we have a panel of experts amongst us, and actually all of you are experts. So if our panel decides that they don't know the answer, I'll ask someone else. But in terms of the panel, we've got Nav and Janet, and also Susie, because we're very much talking about teams. And Susie, as you know, is your workforce person who's doing some fantastic stuff. I keep seeing the things on Twitter, Susie, that you're doing with workforce. So loads of great stuff happening in BLMK. And Janet, of course, who's your esteemed leader, who's making all this stuff happen for nurses. So really, really great to have you to answer some of those local questions around workforce, and more specific maybe around the nurse leads, but I think you can also deal with that sort of those clinical leads in the PCNs. And Nav, of course, to continue to support some of the discussions around some of the slides and information that you shared earlier. Can I ask for a volunteer to go first with a question? I hope you brought some out of your groups. Put your hands up, or you can do it. You can put in the chat box. I still might make you speak, even if you put it in the chat box. But you'll have to unmute yourselves if you want to raise a question. Has anyone got one to give to the group?
I've got a couple of questions from my group, Claire, if that helps. Although, just ask myself.
Yeah, ask yourself. And then at least you know you'll know the answer.
I'm not sure.
She's had time to prepare.
Feels a little bit like cheating, but if I voice the question, and then perhaps Nav and Janet might be the ones to answer. So the first question that came out from our group was, how do you engage with people that you've not even met before or worked with before, but you need to engage with them on behalf of your project?
Oh, good one. Who wants to go first?
Well, I'm happy to go first, because I'll tell you a bit about one of the teams that I am currently in. I'm Deputy Clinical Director for my PCN in Milton Keynes, and so I am the representative of my surgery, Walnut Tree Health Centre. I have some great GPs. But when the PCNs came into being last year, I didn't know what they were, but I knew I wanted to know more. So I'd asked, could I go along to the steering committee, and the GPs that I work for said, actually, you can be our representative. So in I walked to the room, and there were an awful lot of double takes, you know, a lot of swiveling heads, but you're a nurse. And these are lovely people, lovely people. Oh, I don't know that a nurse can be on the steering committee. And I have to say, my heart was probably beating out of my chest, because I felt a bit of an imposter, but had permission to be there. And I didn't know any of them. I'd heard the names of the GPs, I'd heard the names of the practice managers, I hadn't worked with any of them. Now, 12 months later, I'm absolutely part of the team. They email me, we talk all the time. And so the way I engaged with it, so my top tip is be yourself. Authenticity. Don't try to be anything you're not. I was absolutely on the back foot. I didn't know much about PCNs, but I read a lot, and I talked to people, and I went to talk to people and said, can I have a bit of your time, please? Could you explain a bit about this? So I wasn't afraid to show my vulnerability or lack of knowledge. There's something people like, helping other people. Generally, it's a human trait. So when I went to ask people for help, they were more than happy to give it to me and support me. And so the people that I sit with now on the steering committee are friends and colleagues, and I've done nothing different. I haven't changed how I am, but I've allowed myself to be supported by them and to share experiences. So I would say authenticity, and ask for help, and try and engage and offer to be helpful when you can. So I haven't shied away from any of the projects or the work that's been done. So I think people have trusted me, a bit like Karen said earlier, they trust me to get something done if I say I'll do it. So those would be my tips for engagement.
Thank you very much, Janet. Nav, do you have some experiences or practical tips?
Nav, you're on mute. Nav, you're on mute.
Sorry, I was just saying, Janet, it was always very it's always worth listening to someone as wise as yourself on these issues. But I guess I'm just saying from a mechanical point of view, Susie, because it felt like your question was if you've never actually met a bunch of people before, how do you get into the sort of steps of trying to build a team? Is that right? And if you're the the facilitator or the leader of that group, so I would just go back to the kind of principles that we've outlined around the Michael West points, which are, the first thing to do is try and build a common purpose from the group of people. So can we spend a bit of time understanding what the problem is and encourage people to contribute to that? So if it's a group of people with frailty, just understanding what we mean by frailty, what are the kind of what are the group needs around that, just something quick that binds people together around the purpose. And then the other I guess the other thing then is, as inevitably people introduce themselves, and often those introductions are very much around how important people are, and I would avoid that, and I would go into more about what skills or attributes can people bring to the problem that we're discussing, so that quickly gets into a conversation where people feel maybe valued and they can say something about something about themselves, which is around the skills they have. So I think that just starts to get people into the conversation around team-based working, because it starts to bring together the various elements that you're wanting to put into the team that you're going to construct. Does that make sense, Susie?
Yeah, thank you. And I suppose just to add to that from my perspective, so my role is across Bedfordshire, Luton and Milton Keynes, across the whole integrated care system, multiple different organisations. I like to play this fun game where I pretend there are no boundaries and there are no organisational boundaries, right, and there's no hierarchy either. Right. So, obviously I don't go around saying that out loud, although I just have, but, you can,
on record,
confidentially between our group, if you forget about all of those things and just have conversations human being to human being, and see someone, as Nav said, with the skills and, the experience standing in front of you, forget about all of the other stuff. None of it's really real anyway. No. You can just break through so much. So that would just be my added.
No, that's really good. That's really good, Susie. And also just remind everybody that always start a conversation with why it's important rather than what and how. All right. So that is another quick way of getting into people buying into a set of concepts or a conversation. So yes. I think those are helpful things.
We talked about the why actually in our breakout group.
Oh, great.
When we were talking about engagement, and we were saying, if you're trying to engage patients, it's great to tell a colleague in a project, it's great to tell them the health benefits for the patient, but equally, they're going to want to know what's in it for them. So increased joy at work, better team working, absolutely good to plug that kind of thing to make them feel involved and valued and part of that team, because we all need that value feeling in our day job.
Very good, thanks. Great. Thank you very much. I know that it's quite scary, and you can imagine that for all of us, I can't tell you how scared I get each time I'm starting these webinars and thinking, oh, I've got to talk to all these fantastic people. Now you've just heard that you're all human. We're all human beings. We're all the same. We've all got value to add. Can I ask one of you? So you must have had some questions that you were thinking about in your breakout groups, or you can get your dog to ask the question if you prefer. But unfortunately, I don't speak dog. And I'm not. Maybe our expert panel does though. So that could be a challenge. Does anybody have a question that they want to bring from the discussions that they were having in their group? Oh, Emma, brilliant, thank you.
So we were talking about what skill set we need in our team, and then identifying how we so identifying what skill set we need, and then identifying what training we feel is available to help us meet that target of those skills, so that we know that we're up to speed and our team are up to speed with those skills. So my question would be, at this moment when things are very tricky with training, etc., and you know, you just can't sort of seem to, I'm not saying, I mean, I know there is stuff out there, but how do we tap into it, and how do we access it, and how do we, how can we sort of say, this is what I need and where can I get it from?
Great question, Emma, thank you. Who wants to start? Susie, do you want to start with that one?
Yeah, I think that's a really good question, Emma. It's almost like you don't know what you don't know, isn't it? So I think, you know, obviously there's a whole raft of continuing professional development training that we can offer as a training hub, but if it's more than that, and it's more of a coaching conversation to unpick exactly what each person needs or wants and what that might look like, I think coaching is probably the better first point of call to go through that experience, to really understand what it is you think you need. And everybody's going to be slightly different, but if it's a more formalized program, you know, that's something that we can look at and support from a training hub perspective.
So that's very practical advice. Thank you, Susie. And Janet, have you got what from your perspective in terms of maybe some more specific stuff around GPNs and this program? What's your views?
Well, as in what the GPNs will need to get them up and running. I think networking, I think that is, I think inherently nurses are good communicators, and I would say use your communication skills. And just as Susie has said, we're all humans, forget the hierarchy. One thing that COVID has taught us is, and I know we've said this before, skills have been more highly valued than the status someone brings. Therefore, use the people that you know. Don't be afraid to get in touch and reach out to people across your PCN. Generally, nurses want to help. We want to make things better. We want to be part of a team. So use your really inherent communication skills and see what's out there. And I think as PCN leaders, you have a mandate to offer something. I think it would be okay. You know, I would find it fairly reasonable to get in touch with some of my colleagues and say, is there anything that we need? Should we get together? We could plan a little Zoom meeting. Would it be helpful if we talked about this? So not everything that we learn is in a formal setting. If we were all in a venue today, rather than our little boxes, then we'd be sitting round, we'd be getting up, having our coffee, we'd all have those ad hoc conversations, and we'd learn bits and pieces about each other that wouldn't necessarily be a formal thing, but we would take away that would be helpful. And although the virtual setting it takes a bit away from that, I think it's still okay, and you can take the lead and get in touch with people and see and just talk to people and see what they know and share your experiences.
Very good, very practical. And Nav, do you want to add anything to that?
Well, just very quickly, and I get the sake of repeating myself. I mean, I guess the challenge is if we want to keep the kind of value of population health management is to focus on people with need, groups of people with need, and then also the step around what the functions of care are for those people, I think is an important step before we drop into what training do people need, because you know you do need to think about, you know, for a group of people with, say, frailty, you know, there are particular care function needs, and you know, a group of you, 2 or 3 of you, be able to identify what they are without any knowledge or understanding of what the disease is, or what the, you know, what the kind of you know, medical conditions are. You know, things like, you know, medicines management, recovery, rehabilitation, help with housing, welfare benefits, relationships, you know, relationship building, psychological support. You can identify those fairly quickly, and then I guess the question then is, have you got skills in those these areas which you can develop or grow, and that's great? Or is this a role for somebody else to step into? Or is it a particular new need that Susie needs to commission educationally for a group of people? So I think it just lends a different way into a conversation about training, rather than, is there a course on, you know, A, B, C, or D that I can go on, which I know wasn't what you're saying, Emma, but it's more about thinking a bit more around the population and a need of people rather than the need of the individual. Both are important, but it's just how we bring those dimensions together.
What a fantastic group panel we have, all coming from giving different perspectives, and a really, really helpful way of looking at that. So very practical. So what's the actual gap? What's the needs that we need to address? And I think, Susie, you talked about that from a coaching perspective. Nav, you're talking about it from a population perspective. What is it that what's the problem we're trying to solve? So, and then that very practical thing, I think what we're saying is, wholly here, we probably have the means amongst us here to sort a lot of it out without seeking any formal programs or trying to set something up to do that. Excellent. But I think the final bit of that was, if in doubt, ask Susie. Is that all right?
It absolutely is. And another program that I'm just conscious that I've probably not mentioned before to this particular cohort of people is, we've got a system-wide Stepping Into My Shoes program, where you can decide that you might want to, I don't know, shadow a social worker as an example for a day, and we can facilitate that for you. So there is a kind of a website, an application process, very simple. You know, have a think about what it is that you might want to shadow, and then we can facilitate that for you across Bedfordshire, Luton and Milton Keynes. So just as another option.
It's so fantastic, isn't it, for you? You've got this access now. You know exactly where you need to go if you're trying to put something together in your system, and Susie can help you around that workforce piece, along with Janet, and all of you here have the answers, which is fantastic. I am going to have to close this.
I was just going to say, Susie, to get that information, do we go onto the website then? Is it all on there available for us to find? And
I'll send you the link.
Thank you.
And also, just to add, sorry Claire, because I'm conscious of time, there is also, you know, a huge benefit in buddying with each other. I know that time is of the essence and nobody has any spare time, but, you know, I'm just thinking, we've got Pete, we've got Matt, we've got, you know, different professions here, we've got Darshana. You know, there is something around, maybe as a group, thinking about putting some time aside to buddy up, spend a bit of time with each other.
Fantastic, all good stuff. We're all learning how to learn and how to share our learning as well, all at the same time. So I'm going to put you back into the breakout groups. For this session is now about, okay, so what? What are we going to do now to plan for next week? What are we going to do about the learning that we've got today? How are we going to start to apply it? So thinking about the actions that you might take. Next week, we are, it's a bit of a session without any formal input. So we want to do a bit of a review of where we've got to. Is it working? What's working? What's not working? What could we introduce that would be really helpful? And we're also, and Jag is going to help us with that, and we're going to share some of the feedback that you've been giving us to date. And we want more and more and more of your feedback, because you are setting the scene nationally for 6 more of these across the country. You are the vanguard of this particular program, so we really, really need to know whether it's working, and we need your help with that. The other thing we're going to do next week is give you a chance to do quite a lot of action learning together. So exactly what we've just been talking about, this buddying thing, talking to each other, solving problems together. And we want you to think about what those challenges might be. So if you can go into your groups now and start to think about what you're going to do, how you're going to start to take this learning and apply it. And you've got 10 minutes, and then we'll get back in to finish off. Okay, thank you very much. Well, welcome back. Before I forget, because so every time we do this session, I ask if you're okay with me doing a photograph so that we can tweet about it. So I'm just going to ask again, are you okay if I just take a photo of you all? So yes?
Yes.
Yes, okay, quick. Quick smile, and hopefully that will go onto Twitter tomorrow. We've got our own Twitter handle now. The whole care program has its own tweety thing. I don't even know what it's called, but there you go.
Oh, brilliant.
So look out for it, and we all want you to be part of that. So and I hope that you've found today useful, and the breakout sessions have been adequate for you to get the conversations and the discussions and the help and the support that you need through this. All of the, I'm just going to keep repeating this for new people as well as those of you who may not be looking at them. We are recording all of this, so you can go back and have a look at it. So if you want to have a look at what Nav talked through today, or Johnny talked through last week, or Liz the week before, or Janet, you can go back, and so all those presentations are available for you. And I'm trying with each of the prep, with Janet, we're trying to make sure that each of your prep packs has some of the key information in it. So we're capturing it and repeating it for you as you go along. If there's anything that's missing, please let us know. Jag is going to send you straight away after this another link to do the evaluation. And as I said before you went into your breakout groups, we need your feedback, even if it's good. Well, actually, especially if it's good, but we also need to know whether there are things that you need us to change. And as long as you say it nicely, we'd really like to hear it, because it's very helpful. So just for next week, then, along with the things that you already talked about in your breakout groups, two things we'd like you to just go and do. One is to go and find out who all your nurses, all the AHPs in your PCN are. If you don't already, go and introduce yourself, go and find them, go and start talking to them about what you're doing. And we might well ask you next week to tell us how you got on. And that just starts that whole process of thinking around your teams. And then the final bit, to use a term that I've stolen from Janet, we want you to bring the pebble in your shoe. Is that the expression?
Yeah.
So bring those uncomfortable challenges that you are facing at the moment to next week's session, and we will work with you to see how we can help you to address them collectively. Anything that anybody else wants to add before we close the meeting?
Yes, I think one of the things that we'd also talked about earlier today, that we'd quite like as homework, is we'd like to encourage you to introduce yourself to your PCN members. So other workforce members, nurses, AHPs, maybe a quick introductory email, tell them about what your role is, and encourage or invite people to come along with you and see how that goes, because these are the people that you want to engage in. And for anyone that hasn't looked at any of the links, and I appreciate you're very busy, see if you can get to the Simon Sinek about the why, and the Margaret Heffernan forget the pecking order at work, the social capital. That's a good one. Yeah, and connect, build those relationships.
Fantastic, thank you.
Sorry. Anyone that hasn't got the Tiny Mind app yet, I know we keep talking about this, please email me, because you will be doing some work with Beck from the 1st of July, and so it will be really relevant if you have it. Sorry, Claire.
No, thank you very much. I'm actually delighted to say that we are finishing exactly on time, which is my one goal as the chair of the meeting. So thank you very much to everybody. Thank you, Nav. Thank you to our expert panel, Susie and Janet, and thank you to all the facilitators and each of you for joining. It's great to see you, and it's great that your group keeps on expanding. So keep it up, and see you next week. Have a good one. Bye.
Great. Bye.